Hello, everybody. It's such a pleasure to see such a full house here. I was recently in Toronto speaking about legalization of cannabis on 420, actually, and it was a bit of a smaller crowd, so this is fantastic. I have a speech prepared. I was all ready for this, and my colleagues in medicine, Dr. Montgomery and Dr. Sinha, did an amazing job talking about all the other things I wanted to speak about. So I'm going to put this aside, and I'm just going to have a conversation with regards to where I'm coming from, particularly due to the fact that I have a practice in Ontario as well as a practice in Alberta, and my roots are from British Columbia, where I did my training in anesthesiology. So I've seen a full spectrum when it comes to the perspective of people regarding medical cannabis use, specifically in the medicinal component. My practice here in Alberta is very new. It's been 1 year since I moved to Calgary from Toronto, and I'm actually in Airdrie. And my practice has really opened up my eyes. And it's very much in line with what Dr. Montgomery and Dr. Sinha were saying. It's a very patient-centered need when it comes to medical cannabis use. And the conversations that are coming through in my office are primarily, I am stressed out because I don't know who to talk to, because I don't know how to manage my pain. And the side effects of the medications that I'm currently taking, I don't know how to manage them anymore. And my family physician doesn't know how to help me, so I'm here. Can we talk about it? And when it comes to medical cannabis, in my perspective, it's a tool in my toolkit. And pain management overall is I would say, part of the crisis that all of us as Canadians are facing, because there's a lack of education overall when it comes to how do we manage our pain. Pain is multimodal. It comes from a cognitive part of our lives. There's a socioeconomic component to it. And obviously, there's a huge play of our pharmaceuticals that we've been hearing from our patients and from our physicians about. But when it comes to me as a specialist, there was this driving need to learn more about what I could do. So my chronic pain training and interventional procedures was to do nerve blocks, joint blocks, muscle blocks, and alleviate the pain, because in the operating room, I do that very well. And in chronic pain, it was just like, how do I make this better? And I became involved with a pain advocacy group in chronic pain in Toronto. And as a director for this group, wanting to learn more about how to manage patients' pain, specifically in Ontario, we'd have our board meetings, and our hotline phone would just keep ringing and ringing and ringing, and it would go to voice. And when we would collect the calls, the primary question everybody had was, do you know a physician who is willing to authorize medical cannabis for me? And all eyes in the room would turn to look at me, and I just kind of look back and say, hold on, I need to know more before I do anything. And that's, I feel, the consensus of most physicians. Due to the fact that Dr. Sinha and Dr. Montgomery have identified, we have this training in our medical field that we have predictable approaches to pain management, or predictable approaches to medications in general. And now we have a natural herb that has a benefit for us as humans that we don't really know the full extent of. And the public is asking for it, and there's a judicial ruling from the Supreme Court saying that the government has to allow for dignified access, and we as physicians are the gatekeepers. And so I spent a lot of time in 2015 learning about cannabis from the drug prohibition, from the Supreme Court rulings, resulting in a huge document that I submitted to the Ministry of Health as well as the City of Toronto, because at that time, as a physician, what was really plaguing me was the startups of many medical dispensaries for cannabis. And what I was challenged by was that I didn't know what those dispensaries were selling to patients, and I couldn't trust it. And at the same time, I also knew that there was a regulated forum that I could go learn from. But these said patients, if I didn't tell them or direct them, they were going to go to these dispensaries or go to the street, and I would never know what harm they could get because of that. So I spent a lot of time learning about this, and an opportunity came up last year to speak about the dispensaries that were being raided during the hashtag Project Claudia in Toronto back in late May of 2016. And the point that I wanted to make then, I'll reiterate it here, is that The stigma against medical cannabis is real. The stigma around cannabis is very, very real. And we need to be very careful in understanding that recreational use is very different from medical cannabis use. The medical cannabis user is using this to improve function for themselves. They're using cannabis to improve quality of life. A recreational user is looking to alter their sensorium because they're looking to escape from whatever reality that they are facing. And people who recreationally use medications, they'll recreationally use oxycodone, they'll recreationally use morphine. And so it really is about the person. And so, of course, we can add alcohol into the conversation and all the other illicit drug uses when it comes to that. But my point is that the person's very different. And it was very clear in the panel earlier today from the 3 patients that were here that it is a very different perspective, a very different use. And as a physician, knowing that now, how do I best prescribe? How do I best authorize? There is a lot of information out there, and I'm privileged as a specialist to be able to take that time with my patients and do a lot of research on my own through my private practice on the licensed producers. So a quick question for everybody here. Does everybody know what a licensed producer of medical cannabis is in this room? Wow. So I would say I think I saw maybe 10 hands up right now. So a little bit of historical context of this. So licensed producers came into play around 2013, 2014, when the MMPR came into effect, which is now known as the ACMPR. And so the licensed producers are companies that are legally and federally regulated by Health Canada to produce large amounts of medical cannabis to be sold directly to the patient. And medical cannabis is grown under very strict conditions. They adhere to agricultural and food and safety protocols. There's every day you can have an inspection. So the amount of safety protocols in place in Canada is worth an applause, actually, I believe, in the context of the rest of the world. And so the licensed producers then require a registration of a patient with their company, and then they require a medical physician to submit an authorization form stating how many grams of dried flower a patient is required to have to treat their ailment. And then the licensed producer will match the patient's medical document to their registration and then initiate them through their process of being able to directly order. And so they have patient care services, and they will speak to patients on the phone, and they'll say, what are your ailments? What are you looking to treat? And then based upon that, they will make a recommendation. And this is where I came in. I said, how do they know? What do they know? How come I don't know? I'm supposed to be the medical physician that's authorizing this. I need to know more. And so I've spent a lot of time working and learning about the various strains and their benefits while I was in Toronto, and understanding and touring different medical facilities that made cannabis, so I understood better what this was versus my exposure in my 20s in Vancouver, which was bud on the street. Completely different, obviously. And so from that perspective, what I have learned, I have implemented into my practice here in Alberta, and my last year has been phenomenal. I am so amazed at the changes I'm seeing, and I feel truly that the research that's needed now is impending upon this legalization of cannabis. I could have done so much research out of my practice already on migraines, on fibromyalgia, on opioid reduction, on back pain, on arthritis, on reducing antidepressant use, on reducing antipsychotic use for sleep, just because I've seen those benefits, but I can't quantify anything because I can't legally research this. And so by virtue of being able to shift our conversation of saying, yes, we understand there's a medical purpose, and the government currently is interested in how to manage this from a public health safety perspective. My biggest agenda as a physician is when it becomes legal, I can study it so we can get the proof that we're looking for, so that the patients who have been advocating and are actually doing the social reform of medicine right now will be able to say yes, and so more physicians like myself can feel empowered to become educated about how cannabis can impact their patients. One of the anecdotes that I've learned in my own practice is that THC and CBD have very unique qualifiers to them, but interestingly, when you have higher doses of CBD, you actually reduce the effect of THC on the brain, making it less psychoactive. And I guess this coming from the fact that as an anesthesiologist in the operating room, I'm very used to pushing medications and seeing the effects of them in real time. And so when I talk about vaporization with my patients, it's because I've been vaporizing patients for years. The lungs are an excellent conduit for being able to get the blood concentration to a high enough level that it affects the brain. And so in the OR, I put a mask over your face, turn on a machine, it's a heated chamber, and a gas then is inhaled by you, and I have a endpoint that I will use. And so when I talk about this with my patients, when it comes to vaporization versus combustion, I'm very clear about this. Hydrogen cyanide is when the plant is burnt. So I don't want you to get cyanide poisoning. Why would I ever want that? I'm a physician, do no harm first. But vaporizing in this instance, what I'm wanting to happen is that the THC is decarboxylating to an extent that you can inhale it, and the milligram dose that I'm wanting you to get is going to reach your mind. When you use an edible oil, it is unpredictable, just like Dr. Montgomery said. And the reason being, when you go through your liver, everyone has different genetics, but everyone has different digestive systems. And due to that, it's very unpredictable. However, the key thing that I always talk about with my patients is that if you don't have an endpoint, if you're a naive user when it comes to cannabis, it can be the most scariest thing to do on your own. And so I'm here with you to guide you through this process. And endpoints are achieved by doing things slowly. So I always say to my patients, start slow and go low. So one puff on a vaporizer is enough. 5 minutes later, check in with yourself. 30 minutes later would be peak effect. How did you feel about this? And these are the questions that have been coming up in my practice for the last year, and I have all this information. I didn't know what to do with it. And excitingly, I believe Aline keeps mentioning that, technology is advancing, medicine's advancing, and we're just as humans just kind of keeping up as fast as we possibly can, and we're not, unfortunately. But there's apps out there that can now help you monitor your strains so that we can collect data. I guess you could say my direction or my passion when it comes to how to empower my patients is learning specifically what strains to use. And the licensed producers, they have this information because they get all the data from the users. And when they get all this data, they're able to keep it, but they aren't able to share it with the physicians properly because of the legality and intellectual property and all of the other things. And I feel like myself, as a curious individual, I'd like to encourage my colleagues in medicine to push themselves a little bit more out of their comfort zone. One of the things I always say to my patients when they ask me, is it safe? Because that's the first question I always get. And I say this tongue-in-cheek, and I hope I don't offend anybody when I say this, but I always ask everyone, have you ever lost someone or know someone who has died of an overdose of cannabis? And they've always said no. And then I've asked them, do you know anyone or have lost yourself someone to an opioid overdose? And unfortunately, I hear the yes answer way too frequently recently. And so that point being made, there is always going to be a threshold when it comes to harm, when it comes to any kind of medication, or when it comes to anything that we do as humans. If we eat too much, we can cause ourselves harm. If we don't drink enough water, we can cause ourselves harm. If we drink too much water, we can cause ourselves harm. And so there is always going to be a gradient, and everybody in this room here is clearly interested in becoming educated, and I think this is the perfect opportunity to become more educated. But I will advocate and say that in my practice, cannabis has made a profound impact in reducing pharmaceutical polypharmacy use when it comes to the constellation of symptoms symptoms when it comes to secondary issues of pain, such as anxiety, insomnia, and depression. And so I'm an advocate for it from that regards, but I'm also an advocate for public safety. It is so important for me that patients understand that when they use CBD and THC together, they're less likely to be high and therefore safer to be interacting in their day-to-day activities. And so primarily, I will never use THC as a starting point for daytime use. I will only use CBD, and I will vaporize to help you achieve an endpoint so you understand what it means to be psychoactively affected, because you will be psychoactively affected by morphine. Trust me, I've seen it in the operating room hundreds of times. You will be psychoactively affected by your Percocet, but if you don't have that understanding, you won't know when you take 3 what it's going to be. And so it's important to have these conversations with our patients, and it's important for the public to have conversations with themselves, because education really is power when it comes to this. Last but not least, when it comes to the legalization implications, I had the privilege to speak and work alongside Raf Sukar. I was speaking with him last month. He is the RCMP officer and deputy commissioner that was appointed to the Prime Minister's task force on medical cannabis. And Raf and I had a nice conversation after our talk, and I asked him, what changed you? I mean, you were the drug enforcement guy. You were the one coming down and saying that cannabis was the worst possible thing ever. And frankly speaking, I was really intimidated by you. I didn't know what to expect today. And the fact of the matter is, he met with a group of individuals, just like I had met with so many people in my advocacy work, that had benefited from cannabis. And when you realize that this is not what the media is portraying, that this is, teenagers hanging out at English Bay in Vancouver on 420, lighting up bongs. This is everyday Canadians finding a value of this, but they're too afraid to talk about it because they just don't know how to. It opens up your eyes that the conversation needs to be about public safety and public awareness, but most importantly, public education and compassion for each other. And so when Raf and I discussed and talked about this, it was very heartening for me to understand that he and I actually were coming from the same place, that we want to provide dignified access to patients looking for an authorization because they want to explore this as an option for themselves, but they're just not sure how to do so. It's very easy to do so, and I'm keen on teaching my colleagues here in Alberta. I do a lot of educational talks already with physicians, specifically family physicians, on how to set up their practice to do medical authorizations and what kind of time do they need and what kind of protocols they can put in place from an educational perspective to also maintain workflow. I love how Rishi pointed out that as physicians, we're very much burdened by making sure that the system continues. And so, your busy day in the office, you want to make sure that you just get through it because tomorrow is just going to build up. And I learned that the most in the operating room. You had to whip through those days pretty fast. And the challenge is that sometimes when we get into our predictable states of how we are, our conversations with our patients become limited. And I really think this is the patient-driven social reform of medicine when it comes down to cannabis. I have so much more to say, but I feel like there's a lot of questions in this room as well. And so I'm going to take a step back, but I'm happy to stay up here and answer any questions about my personal practice if necessary. Thank you so much.